Hey everyone, today we're going to go over thoracic outlet syndrome treatment. Now I've done videos before on what is thoracic outlet syndrome, so you can go to my channel and look at my playlist, go to the shoulder section, you're going to find thoracic outlet, and so this is going to be some additional treatment options that you can do at home. The first thing we're going to do are chair extensions for the thoracic spine. So you can see the back of this chair is a little bit high, so you probably want one a little lower if you have it. If your chair is wooden or it's plastic and it's got a hard surface there, you can take a towel, fold it over so it's a little more comfortable, not so invasive, for the spine as you go over. And you can start off just leaning over just like this. You don't have to put your hands behind your head. You can go a little more aggressive and go in that fashion. Put the hands behind the head, and you maybe complete somewhere between 10 to 12 repetitions for 1 to 2 sets. Next thing we're going to do are doorway stretches. Now this doorway is a little bit wider than the average door probably within your home. However, you're just going to go up, bend your elbows, try to get them as high as you can initially. Maybe you're just starting low. You're going to feel that stretch across the front part of your chest and shoulder. And you're going to work your way so you get your arms higher and then you lean in. You're going to feel a good stretch there. And this is one of those things, like, you want to go in and not just go really crazy with the stretch. Just be easy and just sustain the stretch. I'm working towards somewhere around 20 seconds or so, maybe even 30 seconds if I can hold it, depending on how sensitive all this is. You may not be able to hold it too long because your hand may go numb or tingle. So you're just going to try to lean in as best you can a little bit, hold that stretch. You repeat that a few times, and I would do that just throughout the day. Now I call this exercise band pulls or pull aparts or horizontal shoulder abduction, whatever you want to call it. And what I'm going to do is I'm really focusing on squeezing my shoulder blades together when I do this exercise. So I'm going to take a band here. You want one that's light enough that you can really control this first, then you can progress with how strong that the band is. I'm going to hold it out in front and I'm going to pull it apart, and when I go apart I'm squeezing my shoulder blades together. So I'm really working on pinching my shoulder blades together when I come back, and I should hold that 1 to 3 seconds. Some people will pull it back and just really hold it just like that. That's fine too. Build a little endurance and capacity within those muscles on the back side there, because remember, we're trying to kind of pull things back so we're not so closed off like this. And so that's a good exercise to do, and I would repeat that for 10 to 12 repetitions, 2 or 3 sets, once a day. The last movement that we're going to do is going to be shoulder extensions. Okay, so I've got this band or these bands attached to the top of the door. I'm going to keep my elbows straight. I'm going to pull them straight back, really squeezing my shoulder blades together, pushing straight back, and I'd complete somewhere between 10 to 12 repetitions for 2 to 3 sets once a day. Now, let's say that you don't have these bands to be able to do that with. You can take a cane, a piece of PVC pipe, put it behind your back, and push it off your back, squeezing your shoulder blades together. Now, to add some resistance to that, you can bend over a little bit and then, get a little bit of gravity kind of resisting against you there. You can also, if you don't have a cane or something like that, a pipe, you can lie face down on the bed or the couch and do the same thing. Work on bringing your shoulders back, squeezing those shoulder blades together. Now we're going to do chin tucks. So this is a good exercise or a technique to do to try to reset the nervous system. I really like this technique, and so all that you have to do is you're going to keep your head kind of flat and level. You're going to come back just like this. You can take your other hand, apply a little overpressure, push straight back. You're going to feel a stretch right at the base of the skull. So you want to do that somewhere between 10 to 12 repetitions for a couple of sets, or just throughout the day, whenever you think about it, do 2 or 3 repetitions just as you can tolerate it. The next thing we're going to do is nerve flossing. We're going to say that the right side is the side that you're having the thoracic outlet symptoms on. So what I'm going to do is kind of bend my hand and fingers in, kind of making a fist and coming in, leaning in, and then I'm going to go out and bring my fingers out, and then I'm going to come in, and then I'm going to go out, just like that. Now, there's a lot of variations to nerve floss, so you can do all different kinds and types. That one's just very simple and easy to remember. I tell people it's like you're about to go to sleep and you're kind of leaning over, you're tired, got propped up on a desk or a table, and then you're going to go all the way out like this and kind of go away. Now, if that's too aggressive or too invasive, and every time you do that you get like tingling in your fingers, or it really exacerbates your symptoms so much it's not tolerable, do it this way. So you're going to come in, but then when you go out, leave your head and neck bent to the side. So you could do it just like that. Leave it bent to the side that you're having the symptoms on, because when you stretch away, you're really pulling on that brachial plexus as it comes here, that bundle of nerves off the cervical spine that's coming behind here. So you can just stay leaned in towards the side that you're having the symptoms on. Hope these tips help to try to reduce your thoracic outlet symptoms that you're having and restore function to your upper extremity.